Okay, so today I'm going to be speaking on malaria and how to prevent this. Nigeria has, from statistics, has the highest number of malaria in the world. It also has the highest death rates of malaria in the world. And you probably know that this stuff is serious, or maybe we have taken it too lightly because it's very common. And either you have experienced it or someone close to you have fallen ill because of malaria because it's very common. And most of us know the name, but we do not know what this malaria is. It's an infectious disease caused by Plasmodium parasite, and it is spread through a female Anopheles mosquito. So this is what causes this malaria in your body, and it's very threatening. It's life threatening, especially in some tropical areas in Africa or in Nigeria. And we've gotten so used to this sickness that we don't know that it also leads to other kind of diseases, other kind of illnesses. I think it just comes and go, but sometimes it can lead to something very serious, and we're going to get there now. So, common symptoms of malaria: we have headache, high fever, sweating, abdominal pain. We also have diarrhea for some. Some lost their appetite, they can't eat enough, and then fatigue and weakness of the body. Also, I think we have body and joint ache. Now, this malaria sometimes do not stop where we think it stops. We think we've taken the medicine or the medication and it is over. Sometimes it can lead to other illnesses, loss of consciousness, confusion, can lead to severe anemia, can also lead to difficulty breathing, and kidney failure. Yes, I think we need to make a research on that one. Now, what causes this malaria? Mosquito bite, definitely. So, when you're staying in malaria endemic areas where there are mosquitoes, you're likely to have malaria. Then, lack of mosquito protection, either with some people use mosquito nets and some people take rub creams on their body to prevent mosquito bites. Then standing waters where stagnant water where mosquito can breed, it can cause this. Then you are traveling to high risk regions without preventive medication. So for people that are coming in from outside the country, or you that is moving from one state to a state that has a lot of malaria incidents, you are very prone to taking or getting malaria. Now, why is this malaria very dangerous? Because I think we've gotten so used to malaria that we feel like it's a very common sickness, but it can do a lot of damage to the body. And so two nutrients that can help you prevent malaria or reduce the risk of getting malaria. We have vitamin A and we have zinc, because areas that are very common in malaria, those areas also tend to have deficiency in vitamin A. And this is common because they share almost the same root, which is poverty and lack of nutrients in the body. So that's why you see these two go along. And that's why they are very prone to getting malaria. So we also have zinc, and this is important because it helps the white blood cell to respond to infections, and this is also part of it. This is not saying that when you take this nutrient, you're not going to fall sick of malaria, but it gives your body a higher chance of fighting against this disease, and you can get them from your food, which is just the best option. Not even going for supplements that can give you this. When you can get them from your food, is better. But in cases where the food you take does not contain the required vitamin quantity that you need to prevent you from having this sickness, you can option for supplements. And please go with companies or brands that you trust, because I think looking at the internet, I've been seeing a lot of companies producing a lot of supplements, and I don't know, I can't say much about them because I do not know them. But go with companies that you can trust, companies that have, stood this test of time. Maybe they've stayed over 20 to 30 years. That means they have been doing something good for them to still exist and people trust their product. So you can get supplements when you're not getting the required amount of nutrients needed in your body to fight against this disease. And supplements are not to be taken anyhow. It's best you consult with your doctor and they tell you, okay, you can take this. And sometimes maybe taking a drug, you do not want to start mixing it with these supplements because they may have actually the same thing and then you're not taking overdose. That's why it's always good you reach out to your doctor to advise you on what to do. But supplements are really good for the body because it helps your immune system become strong and fight against infectious diseases in the body. So you can option for this, but always seek the advice of your doctor or your